Hi, I'm Dr. Garima Khandelwal, Specialist Pediatric Dentist. Today we are going to speak about interceptive orthodontics. Now, what does that mean in lay terms? It means that when your child is between the age of 6 and 10 years, that means the child has milk teeth and permanent teeth together in the mouth. So, we cannot put braces if you find your child suffering from crowding or you see the teeth are crooked because he's way too small and braces are put only on permanent teeth. So what do we do if we find a situation like this? Now this is a picture of a 6-year-old child where if you see, you cannot see this tooth out here. The counterpart of this is this. So why are we not able to see this? This is because there is a space problem. The teeth size is bigger and the jaw size is small. So now if we don't do anything, more and more crowding and crookedness of the teeth is going to occur till the age of 12 and 13. At the end of which, you would end up putting braces and removing 4 permanent teeth, and the braces treatment is going to go around for around 2.5 years. Now, what we can do from now, that is when your child is between the age of 6 and 10, we can give certain expander appliances like these ones. These are painless, are custom made, and the children are very comfortable with it. So why should we give this? We are giving this to correct the actual problem, which is the space problem. The expander appliances help to expand the jaw just enough for the tooth to come out by itself. Now if you see in this expander appliance, I have given only on the behind teeth. I have not even touched this tooth, and yet after 2 months this tooth has come out automatically because it got its space. So we have avoided going for braces in future. But yes, there are cases where the crowding is so severe that even after expansion, we cannot achieve a normal alignment of teeth. In that scenario, we do have to go for braces, but we end up not removing the permanent teeth because we were expanding throughout the ages of 6 to 10 years to create space enough to accommodate all teeth with the help of braces. Second example. If you see, many children have one permanent tooth, the top one, which is below the lower permanent tooth. Why is it important? Because it stops the growth of this bone. Next, this tooth is supposed to be inside. Now, if it is outside, it starts to come out of its bone and it comes in the gum, and the gum keeps on going down and down. And in future, around the age of 40s and 50s, the tooth loses its support and falls off. Plus, aesthetically and functionally, this is not a good bite. So what do we do about it? We just give a plate called as a simple Holly's appliance, a cross-bite correcting appliance. The child has to wear it, but they can remove it while eating, so it's very comfortable. And this correction happens in less than 2 weeks. Easy, simple, 90% less cost than compared to braces. Third example, you would see many times in your child aged 6, 7 and 8 years when the lower teeth are coming, they are not in line and one is often inside and the milk tooth has refused to fall off. You wonder why the milk tooth has not fallen off. It is because the new one, if you see the size of this tooth, the size of the inner one is the same. It's bigger in size compared to the space available. Now it has to come up. Where it is going to go? It's going to come from some other way. Now in this scenario, we have to remove the milk tooth because it's not going to fall off on its own. After removing the milk tooth, since the space is small, the new one would be unable to come outside. Again, when the other permanent teeth are going to come out, they are going to take over this place and you would end up removing 4 permanent teeth and go for braces. What can we do from now? We remove certain milk teeth, not the permanent teeth in this age, and start with an expansion appliance like this. This expansion appliance again expands the jaw, and in few months you not only get the tooth out, but you are now creating space for the other permanent teeth to come. Again, if we can create enough space with the help of the child, great, you end up not putting braces. But still, even if the teeth come out in a little weird position, we do have the space to put them in their position with the help of braces. So interceptive orthodontics or early treatment of crowding is always advisable. There is no side effect. You end up saving tons of money, but it's not just about the money. You help the child to not extract the permanent teeth, and that is any day good. Thank you.